Hello sir, good day. My name is Melvin J. Ebo and I am your nurse for today. May I know your name, sir?
I am Christian Garcia.
Okay, Sir Christian. I am here, sir, to do a set of observations on your heart, sir. So we will be gonna inspecting, auscultating, and palpating your jugular veins, your carotid arteries, and your peripheral vascular system. So, may I ask you something, sir? Do you have any history of cardiovascular problems, sir?
Nothing.
Okay, sir. Don't you worry, sir, because this assessment will be remain confidential and adequate privacy is given to the patient. Working phase. Assess the jugular veins. Stood at the right side of the client and position the client supine with the head of the bed elevated between 30 and 45 degrees. Make sure that the head and torso are on the same plane. Instruct the client to turn the head slightly to the left and show tangential light source into the neck. Superficial notch and area around the clavicles to observe for pulsations and shadows. If jugular distension was noted, assess the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein. Emphasize the distension with tangential lightning. Okay, sir? Can you turn your head slightly to the left, sir? Sir, thank you, sir. Measure the vertical distance in a centimeter above the sternal angle by extending a long rectangular object or card horizontally from the point and a centimeter ruler vertically from the sternal angle, making an exact right angle. Repeat the preceding steps on the other side. Assessing the carotid arteries. With head of the bed still slightly elevated at 30 degrees, position the client head slightly towards the side being examined. Palpate the carotid artery cautiously, avoiding too much pressure or massaging the area. Repeat the preceding step on the other side. Turn the head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his or her breath for a moment and auscultate the carotid artery, listening for a breath. Okay, sir. Can you hold your breath for a moment, sir? Repeat the preceding step on the other side. Okay, sir. Can you hold your breath for a moment, sir? Stood at the right side of the client with the head of the bed elevated at 30 degrees and look for any abnormal pulsations. Shone a tangential light across the chest wall over the cardiac apex to make these movements more visible. Simultaneously, inspect the precordium for pulsations while palpating the aortic area, pulmonic, tricuspid, and the apical area. Palpate for hips and lifts using the palm and finger pads flat or obliquely against the chest. For trills, press the ball of the hand firmly in the chest to check for a buzzing or vibratory sensation caused by underlying turbulent flow. Palpate impulses using finger pads flatly or obliquely on the body surface from the aortic area, pulmonic area, and tricuspid area. Palpate the apical impulse using the palmar surface of 2 to 3 middle fingers. Then for finer assessment, palpate with one finger alone to confirm characteristics of the apical impulse, noting for location, diameter, and amplitude. Inspect and palpate the epigastric area at the base of the sternum for abdominal aortic pulsation. Assess for heart rate and rhythm by placing the diaphragm of the stethoscope at the apex and listen closely to the rate and rhythm of the apical impulse. Count the heartbeat for a full minute. Use the diaphragm of the stethoscope first, then the bell, to auscultate the heart in all four anatomic sites: aortic, pulmonic, tricuspid, and apical for heart sounds, extra heart sound, and murmurs. Ask the client to breathe regularly while auscultating. Okay sir, just breathe regularly sir. Repeat the preceding step while patient is in left lateral position, then at sitting position. Leaning forward and briefly stop breathing after exhalation. Assess each arm for size, symmetry, skin color, and temperature from fingertips to shoulder. Note for any presence of edema, lesion, changes in skin texture, and hair distribution. Inspect the peripheral veins in the arms for the presence and appearance of superficial veins when limbs are dependent and when limbs are elevated. Palpate for radial pulse, ulnar pulse, and brachial pulse individually and bilaterally. Assess for capillary refill. Perform the Allen test. Sir, can you tighten your fist, sir? You may open your fist now, sir. Examining lower extremities. At supine position, assess each leg for size, symmetry, skin color, and temperature, from groin to toes. Note for any presence of lesion, changes in skin texture, and hair distribution. Inspect the peripheral veins in the legs for the presence and appearance of superficial veins when limbs are dependent and when limbs are elevated. Palpate for femoral pulse, popliteal pulse, dorsalis pedis, and posterior tibialis, individually and bilaterally. Assess the peripheral leg veins for signs of ulcerations, varicosities, and thrombophlebitis. Inspect the calves for ulcerations, varicosities, redness, and swelling over the vein sites. Palpate the calves for firmness or tension of the muscles, the presence of edema over the dorsum of the foot, and areas of localized warmth. Push the calves from side to side to test for tenderness. Firm knit dorsiflex the client's foot while supporting the entire leg and extension or had the client stand or walk. Assess for capillary refill for both legs and repeat the preceding steps with the other leg. So, here's the summary or the result of our assessment, sir. So, when we assess your jugular vein, sir, the veins is not visible, which indicates that the right side of your heart is normally functioning. The vertical distance above the midpoint of your right atrium is in 7 cm, which is normal, sir. And when we palpate your carotid arteries, sir, it is in symmetrical pulse volume, full pulsations, and thrusting quality. The quality remains the same when you breathe and it changes from sitting to supine position. The arterial wall is elastic, which is a normal finding. And when we auscultate your carotid artery, sir, there was no sound heard during the auscultation, which is also normal. In inspecting your precordium, sir, for pulsations, there was no pulsations in your aortic and pulmonic area, which is considered as normal finding. And when we inspect and palpate the tricuspid area, sir, there was no pulsation also and no lift or heave. In your apical area, sir, the pulsation is visible and it is palpable most PMI in the left fifth intercostal space. The diameter is 2 cm and no lift or heave, which is a normal finding, sir. And when we inspect and palpate your epigastric area, sir, which is at the base of your sternum, aortic pulse was detected in your abdomen, which is a normal finding, sir. And when we auscultate for your heart rate and rhythm, sir, in the apex of your heart, the heart rate is in 80 beats per minute, which is considered normal, sir. And when we auscultate your heart in all 4 anatomic sites, sir, S1 sound was heard at all sites, but louder at the apical area of your heart, which is a normal finding, sir. And when we assess your peripheral vascular system, sir, when we palpate for your radial, ulnar, and brachial pulse, the pulse amplitude is in 3+, which is a normal pulse, sir. And when we assess for your capillary refill, sir, in your both hands, when I press your fingernails, the color returns immediately. The same results, sir, both in your leg, which is considered as a normal finding, sir. In performing the Allen test, sir, your hand flashes within 10 seconds, and it shows that your hand has a good blood flow, which is a normal finding, sir. And when we examine for your lower extremities, sir, when we assess for your legs, sir, it is in symmetric size, skin temperature is in normal, no lesions or edema, and the skin texture is resilient and moist. And also, sir, when we palpate for your lower extremities, pulses, it is in symmetric pulse volumes and full pulsation, which is a normal finding, sir. And when we assess for your peripheral leg veins, sir, there was no signs of any ulcerations, varicosities, and thrombophlebitis, and no redness or swelling over the vein sites. And also, when we perform the Homan's test, when we firmly dorsiflex your foot, which result in a calf pain, which is a positive Homan sign. So overall, sir, it is a very good assessment, and I must recommend to you, sir, that you must continue your daily exercise to maintain this good result, sir. So that's all, sir. Thank you so much for your cooperation and have a nice day.